Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department is closely monitoring the rising COVID-19 cases outside Metro Manila. Also, can the NCR Plus bubble afford to shift to MGCQ? More cases of COVID-19 variants detected in the country. And what do we know so far on the hybrid UK and Indian variant first detected in Vietnam? And later, the government's vaccination rollout for essential workers and indigents. Health spokesperson and Undersecretary Maria Rosario Vergeire joins us live. Despite the Health Department's observation that COVID-19 cases in Metro Manila and nearby provinces in the NCR Plus are declining, some regions have reported an increase in coronavirus infections. Also, the country detects over 200 cases of COVID-19 variants. How ready are we for the so-called hybrid UK and Indian variant discovered in Vietnam? Let's go straight to the source of the story. We have Health Spokesperson and Undersecretary Maria Rosario Vergeire. Usec, welcome to the source. And again, thank you for your time.
Yes, good morning, Pinky, and good morning to everybody.
So we saw 7,000 cases yesterday, a little over 7,000 cases. And this is actually the third straight day that we recorded infections at over 7,000. I believe the last time this happened was sometime early May. What do you see as the reason for the increase?
Well, we have reasons like, for example, the National Capital Region bubble. Although we are seeing a decline in the number of cases, we are seeing that the decline is getting slower and that we are seeing a number of cases again. But of course, what would be mostly contributing to this rise would be the number of cases outside of the NCR Plus bubble. So we have identified now 6 regions wherein there is this increase in the number of cases and their healthcare utilization is nearing the high risk level. So we are now closely monitoring these regions.
Are you talking about Usec, Cordillera administrative region, because this is the high risk areas for ICU beds? You have CAR, Region 2, Region 3, Region 4A, Caraga, and Region 9?
Yes, ma'am, but we have seen other regions as well where there is this increase in cases. We have Region 4B, we have Region 6, we have Region 1, we also have Region 10, 11, and Caraga.
Usec, parang lahat po tumataas yung kaso.
Yes, but if we look at this, we're talking about regions. But within these specific regions, there are specific provinces that are having higher cases, but not really the whole of that region.
Understand. So let's talk about NCR Plus first. You said that we're seeing a downward trend, pero parang lumiliit po. That's how I understood what you said. Bumababa man, parang hindi na po ganun kalaki yung binababa?
Yes, ma'am, because we have observed that during about 2 or 3 weeks ago, the decline was really steep. No, the decline was fast, but right now it's plateauing, and we are seeing this because we are averaging right now for the NCR Plus bubble around 1,100 cases. The decline has decreased from because before it was about 48% being reduced from the number of cases. It has been reduced to about just 30%. So we are seeing this plateauing, and we would like to remind the public that we still need to be very, very careful, be cautious, and comply with the standards for health.
Why do you think it's plateauing?
Well, there are a lot of reasons. First would be mobility. Because of the increase in the opening of the industries because of this lowering of our quarantine restrictions. But we all know that we need to somehow gradually open our sectors. So what we need to do is, even though we are opening the industries or the other sectors, we need to comply with the minimum health protocols. Be very cautious still because the virus is still here.
So if we're seeing an average USEC of about 1,100 in the NCR plus, even if the reduction has somehow plateaued, would you characterize NCR plus in a safe zone right now? Are we in the safe zone?
Well, there is this definition for saying it's a safe zone because we need to consider also the healthcare utilization. So if we look at the number of cases, it is still no at that moderate level. It's at that moderate level. And when we talk about healthcare utilization, it is still at that moderate level. So what we need to do right now is to maintain that and eventually have it reduced to that safe zone that we are saying.
So I guess, Yusek, we need to be very conscious and alert because even if we are there, at any given point, pwede pong tumaas uli yung numbers at pwede pong tumaas ulit yung kinakailangan ng mga ICU beds or ward beds, hence yung sa critical care utilization.
That's right, Pinky. That's why we always remind the public, even though we can see decrease or decline in the number of cases, we are still not at that safe level where we can say that we can be lax in our compliance. Mm-hmm. We need to continue on. We need to have ourselves vaccinated so that we can eventually see that the decline in the number of cases will really reach that safe zone for all of us.
So heightened GCQ is supposed to end May 31. What is the DOH recommending that NCR plus stay within the heightened GCQ, or are we ready to shift to a more lenient GCQ?
Well, right now, and of course, based on the discussions with the IATF and the other concerned agencies, our goal is to gradually open up some of the sectors or the industry so that we can balance the health with the economy. But again, as I've said, there should be safeguards when we do this. And the safeguards would be that everybody, not just the community, but also workplaces, establishments, has to comply with the health protocols that we have. And aside from that, the vaccination should be faster. We should be able to scale it up, and we should be able to prioritize the vulnerable.
So I just want to jump into what we earlier talked about, the ICU beds, because you had already said that occupancy in the regions that we talked about had reached high-risk levels such as CAR, Region 2, Region 3, 4A, Caraga, and Region 9. Yusek, what is the DOH doing to address the problem or what they would need, considering that they are at high-risk levels right now?
Well, there are a lot of factors when we look at the healthcare utilization of the different areas. We have to understand specifically in Mindanao, there are there are minimal ICU beds allocated for COVID-19 because they have few facilities compared to the National Capital Region. So this is one of the things that we have to focus on, that we will be able to enable them to expand their capacity, especially for ICU beds. Another thing would be the referral, the network that they should have within their areas, because if the public hospitals cannot accommodate, and then they should have this network with the private facilities. Third would be the capacity to have ICU beds. They should have the equipments, they should have the healthcare workers. So last Saturday, we had a meeting with the Secretary of Health and our undersecretaries for Visayas and Mindanao, and this was the standing order, that they should be able to map out the needs of all of these facilities so that we can expand the ICU beds in these areas.
But is there already a mandate for them to increase the ICU beds in their areas, considering they are at 71% to 79%? Mataas na po yun.
Yes, ma'am. There is this law that we have which mandates all of the hospitals to have surge capacities so that they can be able to expand their beds to 30 to 50%. Public hospitals should be able to expand up to 50% and the private to 30%. When there are surges happening. So now that there is this surge, they are mandated to expand. But of course, we understand that some of the hospitals would have difficulties or challenges because these are small hospitals or sometimes their resources are not enough. So we are now assisting them so that we can better expand the capacity. Actually, the Undersecretary for Visayas and Mindanao from DOH has already reported that the regions, Region 11, in Region 10, in Region 9, they are now going to have expanded capacity and they would set up more beds within this week.
Do you think, Undersecretary Vergeire, dadating po yung punto na kinakailangan na aside from the expansion of their ICU beds, they may need to look into other alternatives such as, I don't know, we started also building modular hospitals here in NCR.
Yes, ma'am, definitely. There are these plans already for these modular hospitals. We are going to provide all the assistance that they will need. Another thing that has to be done would be the setting up of more temporary treatment and monitoring facilities. Because similar to NCR Plus bubble, when we had our surge, most of their patients confined also in their facilities would be mild to moderate patients. So we can be able to decongest the hospitals from this type of patients so that they can focus on the critical and severe patients.
Yeah, just like what happened in NCR. At some point, all the mild and moderate had to stay in treatment or quarantine facilities. And yung pong severe, ay dapat yun lang yung naiiwan sa mga hospitals to allow more severe cases to be accommodated in the hospitals.
Yes, that's right.
Okay. All right. Still a lot to talk about, the variants of concern and the vaccination also. But we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Spokesperson and Undersecretary Maria Rosario Vergeire. So, Undersecretary, I think it was yesterday or the other day that it was reported that the DOH recorded additional 242 variants of concern, and there were 104 of the UK, the variant from the UK, 137, the South African, one variant from India, and 4 is the P.3. I wanted to find out, are there still any active cases doon po sa nahanap na variants of concern? And is contact tracing being done? Meron ho ba kayong are you focusing on some of these individuals who were positive doon sa variants of concern?
Yes, ma'am. No, so contact tracing is a protocol. No, so it's automatic. So whenever we identify a positive case, even though we have not subjected this case to whole genome sequencing, we do contact tracing already. So for these individuals that were identified, most of them are returning overseas Filipinos. Some of them are from the community, and contact tracing has been done. So out of all of these individuals identified with a specific variant, for the UK variant, 5 cases are still active. For the South African variant, 9 cases are still active. And for P.3 variant that has been detected recently, all of them have recovered already. And for the Indian variant, the individual has recovered already, has completed isolation and quarantine, and apparently is from CAR. So we are now getting other information from these details.
I read, though, Undersecretary, that in total, please correct me if I'm wrong, that the two institutions looking into the genome sequencing or doing the genome sequencing have a total of about 7,500 genome sequenced. I guess what I wanted to find out with you, number one, yun palang ho ba talaga so far ang nag-genome sequence, 7,500? And number two, does this actually really give us a clear picture of the variants of concern that was or are present in the country?
The total for these specimens received for whole genome sequencing, that's right, it's almost 7,500. And we have to understand that we have a limited capacity to do this whole genome sequencing. We can only process about 750 samples per week. And sometimes when reagents gets delayed because there is also this global shortage, what happens would be we use the smaller machine, so we get a lesser throughput for that specific week. So we have this random sampling that we do for whole genome sequencing, which is purposive. We try to identify areas with clustering of infections. we try to identify hospitals with these more severe infections so that we can determine if the variants are causing this kind of clustering or increase in the number of cases. Definitely, we are not getting the complete picture yet because
Yeah.
we are still doing this sampling. But the basic objective of doing this whole genome sequencing really is to first, we have to know if the specific variant is already here in the country. And we have done that already. The second, that the objective would be for us to do surveillance, wherein we do this purposive sampling so that we may be able to identify factors why a specific area has increasing cases.
Any information on the hybrid UK and Indian variant that was detected in Vietnam?
Well, actually, the WHO has already issued their announcement over the weekend saying that they still need to verify this variant, apparent variant that the country of Vietnam has issued their announcement over the weekend as well. So we have to wait for the WHO's information before we treat this as real evidence. Because as you know, it is WHO which officially classifies these variants. Now, for example, if a country will be able to detect these specific mutations in a variant, then they need to submit it to the international network, which is WHO managed. So WHO would evaluate this and will be able to classify if it's really a variant of concern, and it will provide guidance to specific countries. But what I would just want to say would be, whatever type of variant that may be, we still need to practice the minimum health protocols. That is the only way for us to get protected from these variants. And of course, have yourself vaccinated if you are eligible already.
Yeah, so let's talk about that, vaccination. I still have a lot of questions. So I want to talk about A4 first because that is opening up for lahat ng workers as long as hindi po work from home. So NEDA was saying that there are about 35 million of these individuals. But if we look at the NCR plus 8, that's about 13 million. So ito ho ba, Undersecretary, yung priority na A4, lahat na po yan, wala na po yung subsector as long as isa kang manggagawa at meron kang ID at hindi ka nagtatrabaho sa bahay, ay pwede ka nang i-vaccinate?
Well, that has been the one decided on by the IATF. No? So sinabi po dyan, kapag may tatlo po silang classifications. The first one would be all workers from the private who doesn't work at home, meaning they go out every day and do their work. The second would be the government workers, same as what we have said, that if they're not working at home, if they go out and go to their offices, they will get vaccinated. The third would be the informal sector. These are the non-organized workers, the small workers na wala naman talagang malalaking organisasyon, kasama po sila dyan. So ito po lahat ay pinag-usapan. But of course, if we look at that, it will depend on the supplies of the country for vaccines. So tama po yung sinabi nyo, we have this much number of essential workers. So we need to have priorities as well. And one of the recommendations of the Department of Health then was to stratify according to age groups so that we can be able to at least be aligned as well with the current prioritization framework that we are prioritizing those vulnerable among the essential workers. But this will be included in as part of the guidelines as soon as we have finalized it. And again, I would just like to mention that it will depend on the number of supplies that we have for vaccines.
Exactly, because if we look at the numbers, I believe 5 million have been vaccinated so far. I think that's the first dose. 1 million have completed their first and second doses. So if we add that up, that's about 7 million vaccines. It doesn't seem that we have extra vaccines because unless we have more than 7 million that's arrived in the country. Ang dumating, hindi ba, Usec, is 50,000 Sputnik. Initially, may dumating na 15,000. Supposed to be naubos na yan. Another 15,000 supposed to be naubos na yan. And then 50,000. Ito pong 50,000, saan hong mga lugar ito pupunta?
Oh, well, based from our prioritization, because we are now prioritizing NCR plus 8. So dito po sa mga areas na to, but most probably baka around 3 to 4 local governments lang po ang mabigyan itong sa Gamaleya, the Sputnik V, because this is a highly technical vaccine, ano? So yung pagtuturok, yung pag-store nito is highly technical. So we give it to local governments which has that capacity.
I think some of them were given to Makati, Parañaque, and 2 other LGUs dahil nga it needs a -12 storage facility. So let's be clear about it. Dun sa mga excited na or willing na empleyado na gusto magpa-vaccinate, it doesn't seem like this will happen anytime soon because we have to wait for the vaccines to arrive. Tama po, Usec.
Yes, ma'am. So there is this upcoming deliveries for June, and according to the vaccine cluster headed by Secretary Galvez, this would be around 12 million that will be delivered for this specific month of June. And of course, they said, Secretary Galvez said that we can already start with the A4 as soon as the guidelines are out and the vaccines are here. But I guess what we need to have would be some form of prioritization because as we say, this will not be enough for the entire A4 sector that we have identified.
And just to follow up on that, I know you mentioned that a while ago, yung prioritization po for the employees, you were saying that it might depend on their age. So what I'm thinking is you're saying the older ones would probably be prioritized. For example, it could be, I don't know, about 40 to 55 years old, parang ganun po, or 50 to 60, yun po yung mga mauuna. Ganun po ba yun?
That was the recommendation, ma'am, from our experts and from DOH. And so it was adopted naman po sa IATF na sinabi they may do that when we need to do prioritization because we have to understand, although we know that essential workers are really important because they go out every day, they are very vulnerable as well because they risk getting infected when they go out. But we need to go back to the objective of our vaccination. And this is for us to lessen hospitalization, lessen deaths, and lessen severe cases. So we have recommended that if there would be some form of prioritization, and maybe we can do it by stratifying by age group, prioritizing those who are more aged, like we start from 50 to 60 and then 40 to 50 and down the line.
Parang yung bababa po sa senior na bracket, yun yung magiging priority. We need to talk about the status of the removal of face masks for fully vaccinated people. Yun pong green lane, a proposal na green lane for fully vaccinated people. And yung pong possible scrapping of face shields due to the scorching heat. But we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb, our guest today, Health Spokesperson Undersecretary Maria Rosario Vergeire. I'll just jump very quickly, Usec, dito sa A1. Kasi nga po, yung OFWs leaving in the next 4 months are going to be prioritized. Pasok po sila sa A1. And of course, yung nuclear family ng healthcare workers. Ang tanong po nila, meron na po kayang vaccine na available for them? Pending naghihintay pa po tayo, pwede na ho ba sila mag-vaccinate or hihintayin pa rin yung pagdating ng mga bagong bakuna?
Aantayin po natin lumabas ang guidelines. So we are going to issue out guidelines for this revised A1 sector where we have included OFW set to be deployed within 4 months from this time period. So we just issued the guidelines and they can be vaccinated already.
Okay, but meron po bang bakuna na available na for them?
There are vaccines naman po sa local governments natin which includes A1 to A3 allocation. So they can be accommodated. Hindi rin naman po ganyan kadami kung pag-uusapan natin na yung 4 months lang to be deployed ang bibigyan muna natin.
And another question, just a follow-up on that. Would there be a specific brand, especially for OFWs? Meron na hubang communication from other countries? Baka ho kasi merong vaccine preference eh. Yung mga kababayan po natin, OFW, gusto umalis, pero baka mamaya meron pong kinakailangan na specific vaccine brand for them.
Well, we have not received any information or advice coming from our Department of Foreign Affairs and the Department of Labor and Employment. We are continuously coordinating with them so that we can be able to be informed of this. No, but for now, whatever brand is there, that is the best for them. So I recommend that if they will be allowed already to be vaccinated, get the vaccine. And whatever DFA and DOLE would advise us, I think they would be negotiating for this as well.
Okay, status po dun sa review ng removal of face mask for fully vaccinated individuals?
Yes, ma'am. A small working group was created by the IATF so that we can discuss this. And this is headed by the Department of Tourism and the Department of Foreign Affairs. So we will have a meeting within this week. But one thing that I can tell you would be that our experts that with us during this meeting with the IATF Technical Working Group, and there were these discussions. And of course, we would like to be very cautious still because there is still no sufficient evidence that can say that we can really block the transmission. Although good performance na tayo ngayon sa real world data, but we still like to be very sure so that when we implement this, we will not be at risk, especially our vulnerable to COVID-19. Also, we cannot compare ourselves with the other countries doing this already because we have still yet a lot of months to go so that we can be able to cover as much population for vaccination.
Personally kayo po, Undersecretary, would you even recommend that na no face mask for fully vaccinated individuals?
For me, if you ask me, this is my opinion. I would not recommend it at this point because of all the evidences that we have right now that even though we are vaccinated and fully vaccinated, we can still transmit the infection and we can still be infected.
Last, yung pong mandatory face shields, a lot of people are saying, baka pwede na pong hindi na to mandatory, especially nahihilo po yung mga tao, nahihirapan yung tao huminga at napakainit. Are there plans to really review this and possibly not mandate it anymore?
Well, this has been a study done last year and we have adopted it with our guidelines, and our experts have recommended this because they say if you do face mask and face shield plus physical distancing, you get about 99% protection. And that is really of benefit to us. So we have already the Living CPG group, which is the group comprised of different medical societies together with FDA and together with DOH, have already reevaluated the use of this face shield. And based on their study, although conditional recommendations, they still recommend the face shield plus the face mask with the physical distancing. So for now, we will retain this policy. I think it will be beneficial for our population. And I think that it is okay for us to sacrifice a little rather than having difficulty in breathing and you're in the hospital because you got COVID.
Health Undersecretary Maria Rosario Vergeire, maraming salamat po sa inyong oras.
Thank you very much po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.